Welcome everyone to the new episode of the Haptics Club podcast. I'm Ashley from Titan Haptics, and I'm joined by the Haptics crew. We've got Brian from SenseGlove, Eric from Razer, and Manu from Unity. The Haptics Club is a team of people that have a passion for haptics. Our goal is to raise awareness of the amazing tech and people happening in the haptics industry and foster interesting discussions around the subject. We have a blog which you should check out at thehapticsclub.com/blog. And of course, if you want like a swag t-shirt, a cup, a hat with our logo to represent, and we appreciate everyone who does, check out the store, thehapticsclub.com/shop. Joining us today is Dr. Aadeel Akhtar. He's the founder of Psyonic, the company that is redefining what it means to be human through bionics. Their bionic hand, as you can see if you're watching, is helping restore people's sense of touch. And it looks straight out of a sci-fi movie. So cool. I remember meeting Aadeel at Smart Haptics and shaking the Psyonic robotic hand, thinking this is a world where disability turns into superhuman ability. So excited for this chat. There's so much to cover. Of course, we'll talk about a brief intro, dive into area of expertise, and talk about the future of haptics. And we'll, of course, cover challenges and opportunities in the haptics industry. Be sure to visit thehapticsclub.com, and don't miss our next episode. It happens every other week. And last but not least, we wouldn't be here without the support of our sponsors like Haptics Industry Forum, an association that is created to streamline haptics standards and adoption. And of course, foster awareness, increase just general market awareness, collaboration. But that's enough of that. Let's dive into this amazing haptics chat with Aadeel. Are y'all ready to talk? I'm going to hand it off to Brian to get us started. Let's do it.
Thank you very much, Ashley. Aadeel, we're so excited to have you for the first episode of the season. How are you doing?
I'm excited to be here. I'm doing great. I'm doing great. I'm excited to see you all and talk about haptics and the future of bionic technologies.
That's awesome. That's awesome. For all the listeners out there, can you shortly tell us something about yourself and your background?
Yeah. So I've wanted to build bionic hands my entire life, actually, ever since I was 7 years old. My parents are from Pakistan, but I was born in the Chicagoland area in the US. And I was visiting Pakistan. That's the first time I met someone with a limb difference. She was missing her right leg and using a tree branch as a crutch, and that's what inspired me to go into the field. And ever since then, I've been in love with it, and we've gone all the way to making a bionic hand that can be used and felt by people who are missing their limbs.
That's awesome. Great story. So can you tell us something about your company, Psyonic, and the technology and products you guys develop?
Yeah, so at Psyonic, we develop advanced bionic limbs that are affordable and accessible. And so I've got here the Ability Hand, which is our first product with me right here. And so all 5 fingers flex and extend, thumb rotates as well. You can do different grips. So here's like a pinch, for example. If you're at a rock concert, you can rock on. And then our user favorite one is the finger wave, where you can see all the fingers moving at once. And so I'm using these 2 buttons to control it, but typically if you're missing your hand, you'll use muscle sensors, and the muscle sensors will be used to control the hand. But we've made this hand so it can be used with anything. You can use your webcam to control it. You can use brain implants, and we've done all of those things as well. You can use a video game controller as well. And so we have the hands of like robots all around the world, as well as people who are missing their limbs.
That's awesome. For all the people listening, you should really be watching right now the hand that Aadeel brought today and all the animations it does. It's so wonderful. I think to close off the introduction, Aadeel, was wondering, a guy like you who found a company, is building robotic hands. What is your background? Are you self-taught? Did you study? And what type of study does an engineer like you that builds robotic hands? Yeah, what's that?
Yeah, so it's very interdisciplinary actually. So I my bachelor's degree is in biology from Loyola University Chicago, and then I got a master's degree in computer science there. I taught there for a couple of years, and then I went to the University of Illinois at Urbana-Champaign, got another master's in electrical and computer engineering, PhD in neuroscience, and then I left medical school to do this full time because this was a lot more fun than finishing medical school. And honestly, so while I was doing my PhD, that we got the chance to go down to Ecuador, and we had a very early version of the hand that was fully 3D printed and had wires going everywhere, plugged into breadboards, power supplies, the wall. And our patient, Juan Suquillo, he had lost his left hand 35 years prior due to machine gun fire from a helicopter. He was in the Ecuadorian army, and there was a border war at the time. And he was able to make a pinch with his left hand for the first time in 35 years. And he said in front of international news stations that he felt as though a part of him had come back. And that's when I realized that if I stay, the original route for me was to become finish an MD PhD program, work at an academic hospital, and then build this stuff in an academic institution. And when we saw his reaction, we were like, if we want everyone to feel the same way that Juan did, we had to commercialize that technology. And that's when our company, Psyonic, was born. And my trajectory changed from going into academia to starting my own company.
That's great. Thank you very much, Aadeel. So I think it's now time for the area of expertise. Eric, feel free to take it away.
Yeah, absolutely. So great to see you again. And it was nice to have this chat at Smart Haptics. So I won't monopolize this. Everybody can jump in. So I have actually a ton of questions around this one because I piqued my curiosity so much this hands, and it's starting to be so similar, or at least comparable with the normal one. But first of all, can you guide us through two questions? The first one is, what is, from a user experience standpoint, the reason by which you need touch feedback into the hand? And specifically, it is what you cannot do if you don't have touch feedback.
Yeah, and the biggest thing that is a barrier when you don't have the touch feedback is manipulating very delicate objects. So something as delicate as a raspberry or a hollow eggshell, for example, or if you're trying to do very dexterous tasks with delicate objects, like if you were trying to cook with like eggs, for example, right? Those are the types of tasks that really require that haptic feedback. And the other thing is that situations where you don't have as good line of sight to the object as well, so you don't have to rely as much on visual cues in order to manipulate objects. That's where the touch feedback really comes into play. So, for example, for many of our users, when they're holding like a cup of coffee or something like that, they don't want to drop that cup of coffee. And so, if they have that confidence of knowing that, okay, yeah, I got that feedback signal that yes, my hand is gripped around this well, that I don't have to worry about, like, if I move my hand around a little bit that this is going to fall, then that's where it becomes really important.
Oh, that's actually quite nice. And also, like, I think one of the most I think maybe important or interesting things is if you're an amputee and you maybe lost your both hands, is, I mean, even touch your family or touch your loved ones.
Oh, absolutely.
And I think having a similar lifelike interaction, I think that's absolutely fantastic. And yeah.
And I was going to say that affective touch is actually a very important component as well. So our first patient in the U.S. Was an Army sergeant who lost his hand in Iraq in 2005 due to a roadside bomb. And with our hand, one of the first things he told us was that he could actually feel his daughter's hand, and that was something that he couldn't do with any of the other prosthetic devices that were out there. And when he tells us things like that, I mean, that's why we do what we do.
And how do you achieve this magic? So what's going on at the haptic side, or sorry, at least not haptic side, at the tactile reproduction side, that allow people to get this information?
Yeah, and so our fingers that are in the hand as well, and if you're watching, then you can actually see they're flexible, right? So we've got these are made out of silicone, and there's actually like a rubber bone inside of the finger itself. And so on that finger bone inside the silicone, we have 6 sensors that are encased in there, right? And so these are customized force sensitive resistors. So basically we can detect normal forces that are being applied on the fingertip, the finger pad, 2 on the outside of the finger, and then 2 on the inside of the finger as well. And then we can stream all of the raw pressure data or even filtered pressure data over Bluetooth, over a USB connection to whatever system that you have on the other end. And for the most rudimentary version of it, we have a vibration motor. So the user can just feel like a simple vibrotactile feedback when you touch the fingertip, just to basically alert them that, hey, I've touched an object, hey, I've let go of that object, and I can detect a little bit of the pressure on it as well. But because we made that the pressure stream open through our API, we've connected it with brain implants, and we actually had a patient through the University of Chicago he was able to actually feel each individual finger. They blindfolded him, and then they touched the fingers on our hand, and they stimulated that area of his sensory cortex corresponding to his individual fingers. And he was like, that's my index finger, that's my middle finger, and that's my ring finger. And it's all through that same that programming interface that we've developed for our hand.
That's great. So basically, you're leveraging what also David Eagleman, that was here a long time ago, is a sensory substitution. They're using it for hearing impairment. So they're actually segmenting the frequencies in different bands and actually apply them to vibration on the wrist. And what are the vibration? They are here on the arm, right? Or can be
exactly.
anywhere.
So if you're
yeah.
It can be anywhere. Usually it's within the socket itself. So if you're missing your arm below your elbow, then it'll be on the forearm.
Yeah, how did you place them? Was there any a priori, let's say, okay, we have to keep some consistency between the local arrangement of the vibrotactile motor with the fingers, or is it just random, or iteratively arrive at the situation where it is?
So in its most basic implementation, it's just a single vibration motor. So whichever of the pressure sensors has the maximum amount of pressure being detected, then that is the one that triggers that single vibration motor. And what we've noticed is that what's the most useful and the most easy for them to intuitive for them to understand is basically when they've just come into contact with an object, even just that detection and that and the knowledge that they've let go of the object. And when we vibrate on those two cues, then that is actually very helpful for them, and it's very easy for them to adopt and understand and get that. And we can do more complicated things where we can put an array of vibrotactile motors. We can do electrotactile stimulation and have an array of those as well, or we can even go brain implants as well. But each one of those will have its own unique paradigm that you can implement for those specific cases. And so we made it extensible so you can implement any haptic feedback system that you want with the sensors that we have in the hand.
Even temperature? I was wondering if you're able to simulate like heat or cold.
So that's an interesting one as well. And so in an earlier version of the hand, actually, we used to use barometric pressure sensors that could detect temperature as well.
Right.
But reliability wise, they weren't the best thing. And the harder part of that is actually displaying that to the user. And there's actually been some recent research that came out literally within the last couple of months out in Europe as well that displayed temperature information to patients for both rapidly cooling the skin and heating the skin as well. And so once that gets more reliable, yeah, we can easily start adding in those sensors back into the hand and then giving that
Amazing
feedback to users too. And
I love that
honestly,
it's modular and you can just add to it.
Exactly, right? Yeah. And it's literally a firmware update that you can use on your phone to just update the firmware over the air. And I was going to mention with the nerve implants too, if we can actually target your the thermoreceptors in your body, then that would actually be a good interface for doing the temperature sensing as well. That could feel very natural and realistic.
Let me ask you a question. So you're always mentioning about customizability, and the question around this one is how much the community is empowered and how much is locked down over the device. So is the firmware of your device open source and people can flash it and do what they want with that? Or the firmware is blocked and the APIs are open? So what's your take here? Because I imagine this is a medical device, so there is a strict rules around that. And but however, on the flip side, iterations, usually the best one happens outside the company.
Exactly. And so we had to strike a balance between those two. And so the API is completely open source, but the firmware is locked down. And there's also, because there's a bunch of safety measures that we have in the hand, because if you stall the motors on any robot for too long, then it generates a bunch of heat and then it can melt things down, right? So those safety measures always need to be in place in the hand. And so that's why we have that part of the firmware is basically locked. But you can do, through our API, you can do position, velocity, and torque control over all 6 of the brushless DC motors that are in here. And then you can stream all of the encoder data, so you can get all the position data, all the velocity and torque data as well from each one of those 6 motors. And we can have up to 30 touch sensors of the force sensitive resistive sensors all streamed over the API as well. And then you can close those loops however you want to as well. So like based off of pressure data, you can like slow down the hand, slow down particular fingers and digits and things like that.
And how big do you have a community that's already doing this one? How big is it? Is active? How you manage it?
It's growing, and we started really selling to especially on like robotics and the research side within the last like it's been really growing within the last like 6 months, honestly, too. So where I'm excited to see where it takes off in the next 6 months and then like the years beyond that as well.
Oh, that's awesome. And sorry guys, question. So you're seeing this is like it's getting from a mechanical perspective so near a real hand, and I imagine that as part of the inspiration that is you're compliant, you can move it because you always push on to showing us these types of mechanical compliance that are so much similar to the human hands. So from a manipulation perspective and from an interaction perspective, what is subhuman performance, what is human performance, and what is above human performance?
Yeah. So I would say on the superhuman side in particular, right? When I smash this, right? I mean, these fingers can like bend completely out of the way and come back into their original position. I mean, and our natural fingers have a little bit of that compliance in it, but I mean, if you smash it with a hammer, then you're definitely going to break a bone in your human hand. Whereas this might be able to withstand that impact a little bit better. And we've done like things like flaming board breaking. I've climbed to the roof of my house and I dropped the hand 10 meters in the air and it survived dropping 10 meters. We put it in a dryer for 10 minutes and it survived tumbling around in a dryer. Again, I think if you put a natural hand in those situations, it wouldn't necessarily fare as well. I mean, and the thing is, like, I can pop the hand off, right? Another thing that you can't really do with your natural hand, and put it back on, or like switch it out to a different tool if I wanted to as well, like an electronic hook or even like a screwdriver or a drill or something like that if you wanted to throw that on there as well, right? So those are some of the superhuman capabilities. We've attached it to like wrist rotators and done 360 degrees of wrist rotation. You can charge your phone from your arm, so another superhuman ability on that front too. So in terms of limitations, for example, there's only 6 motors in this, right? And the human hand has like around 23 degrees of freedom, 23 joints that you can move. So it's limited in that scope. So one of the biggest ones is that we don't have the ability to spread these fingers apart. We don't have abduction, adduction of those fingers. But a lot of that comes down to the ability to control those movements as well. And if you're missing your hand, those muscles are actually located inside of your hand. So it's really hard to get that information. So when it comes again to the nerve implants, if we can reliably get that information of being able to spread your fingers, then we're going to add those features in, right? Same on the haptic side as well, right? I mean, we only have 30 touch sensors, but you know, the density of receptors in the hand is like, you know, on the order of millions, right? Like and so we don't have that level of specificity of like where you have a 2-point like sub-millimeter 2-point threshold on your fingertips with a hand like this, right? And I think some technology is starting to get there, but again, the question then comes down to is how do you display that information back to the user, right? Because even if we had a fully sensorized hand with like a million sensors on it, if the user can only feel like 5 different touch points, then it's like, what's the point of adding all those sensors in, right? So again, I keep coming back to the nerve implants. If we can really fine tune with at that level of specificity, like, you know, millimeter thresholds between like, you know, areas of your fingertips versus the back of your fingers versus the sides versus your palms, etc., then we will start adding in all those sensors into the hand itself.
Let me take the nerve implants because 10 years back or 8 years back, I was working in Gothenburg with a microneurography team, and we were actually measuring. And this team was in Gothenburg was also building some prosthesis with haptic feedback at the time to again amputee. Was the first one was a truck driver. They was doing a hook, and one of the things that actually they did share for a nerve implant is that the interface stability is really low. Is that it was really, really tough. I mean, it was good for doing a first implementation, but then it just slide off. It was not stable. You was creating some surface problems, these types of things. How did the technology evolve in the latest year, this direction? What can we reliably have from a product standpoint or even research standpoint there?
Yeah, and so from some of the companies that we've seen, and especially some of the groups out of Sweden as well. So this is like the company's name is Integrum. They've been doing some implanted electrode work as well, and as well as bone implants that go directly into your bone, and then you can attach prostheses directly to your bones, which is really cool. I think they've had some of the devices in for like 15 years at this point, and they're functioning really, really well. And I know that in the US with some of the clinical trials as part of like the DARPA haptics program for implanted electrodes in particular, a lot of the researchers have had their patients implanted for over like 18 months, and they've been showing that the integrity of the signals and the integrity of the electrodes have actually been fairly good. And I think it's just that the technology has been getting better with how they're interfacing the actual electrode material and the design of the electrodes into the neural interface as well. The better that you can make that interface, then the more longevity you will have with these devices, and that just keeps getting better and better. And over the next 5 years, I think that technology is going to continue to get better, especially as there's a lot more interest in this space growing, especially with like all the brain machine interface companies like Neuralink and Phantom Bureau and Synchron and a lot of those companies who are looking into this space as well.
Oh, that's fascinating, and building on not on this but on a tangential things regarding on the embodiment side, right? So this is basically a prosthesis that goes on your body, and what you would want to achieve is embodiment. It is actually this is your hand, right? Do you have data that, or at least some feedback that where how much haptics does contribute to this acceptance of this external piece of body to own it as your own, or is it it's contradictory, so it goes on the other direction? And is it maybe some feedback about, is it due to the types of stimulation that you're using, like vibrotactile is not pressure? Is this based because it's not exactly in the same place? So can you elaborate a little bit on this?
I love that you
Yeah,
asked that.
exactly.
It was making me think like
And
proprioception, is it helped by haptics or not?
and so yeah, that's actually a great point there too. And honestly, the key thing towards embodiment especially is that proprioceptive piece, right? And so that's one of the biggest things from a muscle powered or a myoelectric device. That's the key element that I think is still missing, and that there's still a big need for innovation in that particular areas. How do we give proprioception to users? Because once we have that one-to-one relationship between what you're actually intending to do and then what you're actually perceiving the hand doing as well, that's when this is no longer going to feel like a tool attached at the end of your body, and it's actually going to feel like an extension of your body. Now, there have been some studies that have shown that, like, with like, the rubber hand illusion and things like that, that prostheses can induce, with haptic feedback, can induce that rubber hand illusion to an extent. There's limits to what you can do, as you were mentioning, with sensory substitution. Like if a vibrotactile sensation will still feel like a vibrotactile sensation, but if you can at least make it in an anatomically correct location. So let me give you an example of what I'm talking about here, right? So there's special surgeries that you can get. One is called targeted reinnervation. So if I lost my arm at my shoulder, for example, there's 4 major nerves that go into my arm that innervate all of the muscles and all of the skin, right? And that information is still carried in those nerves at that level at my shoulder. They just haven't branched out into the hundreds of millions of neurons that are going to go to all those different places, right? Um, so what they did with this surgery that was developed at that Northwestern and the Shirley Round Ability Lab is they took those 4 nerves and they rerouted them to muscle groups that you still have had, like in your chest, for example, right? And so on the control side, what would end up happening is that you imagine bending your elbow or making a fist, and then your chest muscles would start to contract, and then you could pick that up with muscle signals, right? But those nerves, they carry both sensory information coming back from your skin as well as the motor information that goes to the muscles. And so what ended up happening in their patients was that the sensory neurons regrew into the skin overlying those muscles. And then when you touch them on different parts of their chest, it felt like you were actually touching them on different parts of their hand. And when you give them that kind of feedback where it's an anatomically appropriate like location, right? Then you get better better embodiment. And they did some studies on this where they could detect like the temperature drop in the residual limb, and if the temperature drop is like is appropriate, then they show that's like a sign of embodiment. They've done like EEG studies where they showed like that it was embodied as well, and I think they did qualitative surveys or quantitative surveys, sorry, that showed that there was a statistically significant improvement in things like embodiment in particular, particularly when there's like an anatomically correct, like analogous location.
Makes a ton of
Yeah.
sense, specifically if they were actually poking instead of vibrating. That I think makes a lot of sense because
Yep.
yeah. Okay.
And then
Yeah.
you touched on something too. I mean, the pressure. Like if you're making pressure go to pressure, that's a lot better than making pressure go to like a vibration or pressure go
Yeah,
to.
I think
like
we
an
discussed
electrical
this during the
stimulation.
smart haptics,
Yep.
and I say, obviously the first things you want to do is small bubbles or servos that actually touch you
Yep.
back instead of vibrotactile. But I do understand that from a product development standpoint and company standpoint, you want to keep things easy and manageable, under control from engineering standpoint. And I hope that you win a grant and you can get that money and test it out.
Me too. Me too.
I can help you write a grant if you want. It's fine. I think I can go on for hours and hours and hours. I don't want to monopolize this conversation, so please, guys, jump in. Or we can
No,
move to the
Eric, this
future
has
if you
been
want to.
exciting
Yeah.
because we could feel the excitement in your questions, so no one wanted to plug that. I think Brian wants to ask the next one.
Yeah, I have a question. Aadeel, you mentioned before that you want these bionic hands to be as much an extension of your own body, right? But at some point it can be more of a tool. And I was wondering, can you tell us something about, the users learning to use this tool as an extension of their body, and maybe the role of haptics in that process?
Yeah, and so this is really interesting from a couple of contexts. And so this summer we had the privilege of having our first employee who uses our bionic hand, and so her name was Annika Berlin, and she was actually born without her her left hand. And she went 18 years without using a prosthesis at all, which is fairly typical for people with congenital limb differences, that they just don't use. It's just cumbersome, especially when you're a kid and you're just like, just want to go out and don't have to like throw something on and like wear it all the time, right? And usually what we've seen in a lot of users with congenital limb differences is that when they hit their 30s, they've used their other hand, especially if it's a single side, twice as much as a person who has two hands would. And so they start to get things like arthritis and like osteoporosis and like contralateral like shoulder pain, because they've been using this hand twice as much as a natural. It's like a 60-year-old hand on a 30-year-old body, right? And so the other thing that's very interesting in these cases too is that they don't have a mental representation of what a hand is like on that on the side with the limb difference. And so training for them, it's much different than it would be for someone who has an acquired limb difference from like a traumatic accident or something like that, right? Where they have that mental structure, they know what it means to like bend a finger on that side, or like bend your wrist like back and forth. And so with Annika, I had many conversations with her on how she learned to control the hand, because she has some of the best control I've actually ever seen of one of these myoelectric devices. And so for her, it was just like practicing like every day and just trying to see what muscles that she has in her residual limb that she can just have volitional control over. And they don't necessarily have any analog to, again, having a hand on that side. But she's like, oh, I just realized I can move this muscle. If I can keep doing that consistently, then I can use that as a signal then to drive the hand. And for the longest time, a lot of people like it was like this common opinion that if you have a congenital limb difference, then you actually can't use myoelectric devices really well. But that's actually been like completely debunked, and some of our best users are actually users with congenital limb differences. And so with the muscle sensing, it's really comes down to just practicing and finding where you have those really good muscle sites.
How long does it take the average person to really get a feeling of how to use the hand properly?
It can vary, and a lot of that has to do with the anatomy of the residual limb that's left as well. If you have a lot of muscle and strong muscle, and like few like little fat in between the skin and the muscle, then I've seen people like within like 5 minutes actually be able to control it perfectly. So one of our users was a para triathlete national champion, and within like 3 minutes of him wearing the hand for the very first time, someone like tossed him a water bottle and he was able to catch it. And I was like, that's absolutely insane. And then we've also seen other situations where it's taken like 3 to 6 months of just like having to get used to it, having to go through like physical therapy and like building the muscle on that side, and having that like retraining like what it's like to use the hand. Another factor that plays a huge role in how easily people are able to adopt these devices is phantom limb pain. And if you have a lot of phantom limb pain, then that is something that detracts you from being able to control these devices very well. And there's that surgery that I was telling you about that reroutes the nerves. They've shown that that has been very effective in reducing phantom limb pain. But the nerve implants might be actually another facet of being able to reduce that and give better control of these devices as well.
Yeah, I was wondering with the integrating with the nerves you were mentioning to us earlier. I can imagine that you mentioned that the performance of the hand and the system gets much higher. People will get better control. I was wondering, of course, when you're integrating technology with your body, it can involve surgery. I can imagine there might be some risks. It might cost a lot of money. Can you tell us a little bit how this vision of integrating technology with your body is being accepted in the industry and medical, especially?
Yeah, absolutely. And right now it's all under clinical trials, right? So there's no commercial product out there yet. But there's just because of all the advancements that have been happening there's just been a lot of technological development in this area towards making something that's more commercializable that can be covered by Medicare. I mean, and honestly, when we started building our hand itself, right? Like when we were talking about all the features that we wanted to put in it, and then we were like, and we're going to get it covered by Medicare. You should have seen the look on all the clinicians' faces. They were like, "There's no way that you're going to be able to do this," right? But again, like if you start with that mindset of like, we have to make this accessible from the start, then it forces you almost to think in a different way of like, how can we manufacture these devices from the get-go to be able to be at a price that will actually be covered by insurance. And that's the approach that we want to be taking with the bone implants and the nerve implants as well. And you're right, with any surgery that there's going to be a risk. With the clinical trials that we've seen so far, they've actually been fully implantable and explantable, the nerve implants in particular. And that risk is less with the bone implants. I mean, with that you have something coming out of your body, and so there's basically like a hole that can go into your body, and so they usually recommend don't go into like freshwater lakes or like a hot tub or something like that. But you got to weigh the pros and cons of every situation, right? I mean, the advancements and function like the enhancements in function that you'll get from these kinds of uh, surgeries will potentially outweigh the risks of like a potential infection, and that's going to be on a user by user basis that they'll have to figure out for themselves if they want to go through with it.
Sense. I want to kind of like take this from a level of, you're the founder of this, and you've, brought this thing to life, this hardware thing to life, which, as we all know, this hardware is hard. And I want to know from your perspective, because I think this will help a lot of people that maybe have an idea and just don't know where to take it. Maybe they don't have the confidence to move ahead because they don't have degrees or they aren't an engineer. Can you maybe provide some insight into like some of the key learnings you had, specifically on like the haptic side, because that's such a big industry, so many learnings that you have to figure out on that area, and then just some kind of maybe like a key insight you could share on as like a founder, as someone who's going through the trudges of you're doing administrative trivia, you're doing like you have all the hats basically. So tell us a little bit about that side of things.
Yeah, absolutely. And so especially on like the development side, I mean, one of the things that like having that mindset that I was mentioning, right? That you want to make this something that was going to be accessible to begin with, right? That played a huge role into like the whole commercialization aspect of it, and like the whole thing that drives our company, right? Because if we can make something that's really good, but it only helps like, you know, one person, then it's not nearly as useful as making something that we can really spread across like the entire world and get millions of people using it, right? That's the real impact that we want to make with the devices that we're developing. And so like even on iterating through like the haptic technologies, we will like evaluate something within like a week to a month and then determine whether we're actually going to like do the R&D on it. And so for example, when we started with the barometric pressure sensors, right? And then we probably used those for a good like 2 or 3 years before we were just like, okay, we need to evaluate something else just because of the reliability of these signals. It's not the best thing. And then we tried like, you know, we tried like magnets, we tried infrared sensors, we tried like all of these different things, and we just like quickly ruled each one of those out. The magnets were cool, except that and they could give you like 3D positioning and things like that. But then if you were near a metal table or if you were holding like a fork or anything, it just completely ruined the signal. And we were just like, oh, and we can't have that in a commercial like in a commercial setting, right? Because people are going to be around those things in real life, right? Uh, and so that's those kind of that way of thinking, like where it's like taking the user's perspective and those needs, that's kind of drives everything that we've been doing in the development of things. And then on the like kind of the business side of things, like a lot of that was price point and accessibility driven, right? So we wanted to make sure that we could hit those price points, and we kind of structured everything else around that, right? So we built our team to like our engineers all have that embedded within them. And then we built up like our support team so that they understand like all the new features and how to train like individuals on like you know, because this is the first hand to give users haptic feedback, like how do they best use that, right? And so like our physical therapists are we're hiring an occupational therapist hopefully soon too. They're going to be like leading the charge on like training individuals like how to incorporate like the best practices in incorporating like haptic feedback into your activities of daily living that you're doing. Because for the last like 20 years, all the because haptics didn't exist for prosthetics, all of the occupational therapy tasks had been driven more towards like motor control function, right? Not necessarily like sensory feedback function. So you weren't grabbing like raspberries necessarily, but you were grabbing like functional things like a clothespin or like a block off the table or like things like that. And so we're going to be seeing a kind of like a paradigm shift towards that. And the so in terms of how we learned a lot of this stuff, honestly, we learned most of it outside of the classroom. We did it just by like jumping in head first and diving into things that we didn't know, and then like we had to become experts on it. And that was really the best way to learn, was to just build it ourselves, try it out, and see what works and doesn't work. And I mean, my original background was biology and computer science, not electronics, right? So we picked up an Arduino, we went on Instructables, we figured out how to program it, we figured out how to 3D print open source hands online, and then kept going off of that, iterating, and that's kind of how we figured out where we're at now. And it just took a lot of grit and just resilience towards like, you know, it's a startup. There are low lows and then are really high highs, and it's as long as that trend is upwards, then you're doing
This
okay.
is so inspiring because it's relatable. And I think it's nice that you're sharing that part of vulnerability, that, hey, I do have that background and that, you know, scholarship, but at the same time, like, you can really start from scratch. And if you're, you know, motivated, you can turn that into something that becomes a company that saves people lives. So that's very beautiful to hear.
Thank you. And I will say that one of the things, one of the things that did come out of going the academic route and getting the PhD and doing research, was that we do have a very strong eye for where the future of this technology is heading. And that's why we decided that we wanted from the get-go to make a programmable interface for the hand that can be used with the nerve implants and the brain implants and all of that stuff coming out in the future. Because
Yes.
in 5 to 10 years, we see that this is where the industry is going to be heading.
So this is a great segue for the next section, which is the
Oh,
future of haptics.
before.
Go
What's
ahead,
the
Eric.
price? What's the price point?
What's the price point?
Ah,
Yes.
Yes, yes. So the hand itself is $15,500 US dollars, and that includes like all the electronic components that and the charging and the power switch and all of that. So to put it in perspective, in the US for the hand alone, Medicare, which is the gold standard insurer, will typically cover on average around 31,000 for a hand. And so we usually we try to get this hand covered by Medicare, and if they cover it, then most of the other insurance companies will cover it as well. And so we've expanded access from 10% of patients who could afford an advanced bionic hand in the US to now 75% of patients. And that's what we're all about, making the most advanced bionic hands more accessible than ever.
Amazing. Thanks so much for this. Any last question before we transition? All good? All right, so this is the future of haptics now. So everything I'm going to ask is more of future forward thinking. I want you to be inspired and just say what you have in mind. Doesn't have to be correct. It's sometimes just your perspective on things. So what do you think the world of bionics looks like in about 5 to 10 years from now? And will we ever reach the level we see often in sci-fi like cyberpunk?
Sure. And actually, so I think this is a good time to actually show you what one of the
Ooh.
things that we can do. And so I've got this hand right over here. The only difference between the one that I had before and this one is that this stand has a USB cable that's attached to it. And so I'm gonna actually connect to this to my phone. And we're going to actually do something fun here. You're actually going to get to control the hand yourself from where
Oh,
you are.
amazing.
Yeah.
I'm
And
in
so this is what I want
telecommunication with you.
yeah. So, if you want to go ahead and put your hand in front of your camera.
Yes.
Okay. And go ahead and bend your fingers.
Oh, it's
So this is,
working. Okay, if you're on
yeah. And
YouTube
so,
and if you're watching us from the video right now, I'm literally controlling a hand from a distance and it's really accurate. I'm doing an OK sign right now. We can do the rock and roll. We can do a thumbs up. Amazing. That is so crazy.
and so this is kind of a glimpse into the future of where we're going with this stuff, right?
Right.
So when I was showing you the hand earlier, it's these pre-programmed grips, right, that you control with like very discrete muscle signals, right? But with the nerve implants, we can get this fine individual finger position control, right?
Hmm.
And what we're hoping for is within the next like 2 to 5 years that we'll have our first patients playing piano or typing on a keyboard again, right? So with that level of dexterous control and then that level of haptic feedback where they can feel them put like pushing on the keys and then feeling that pressure sensation back in an anatomically correct location. And so, and the other thing that I was going to mention too is that you might notice that this hand has this like is made of carbon fiber and it has this like bionic like look.
Yes.
And we often get the question of like, why didn't we go with something that was more like a natural looking hand? And there's actually several reasons for that. And one is that when you have a more natural looking hand that like with skin tones and things like that, you can still tell that's not real. And then
Mhm.
because of the uncanny valley or whatever psychological perception, the default reaction of people is one of fear, where it's like, oh, that's a little bit creepy, or it's one of pity, where it's like, oh, I'm sorry you lost your hand, right? But then
Yeah,
when you see someone wearing like a bionic looking hand that's straight out of like sci-fi, right? Their default reaction is like, you have a bionic hand, that's the coolest thing I've ever seen. Like, what are like the cool things you can do, right? And it gives our users confidence. It makes them feel empowered that this isn't something to be ashamed of, right? That this is
I love
something
this
that,
message.
I was born with this limb difference, or like I served in like a war and like I lost my hand for my country, that this is something to be proud of. And if we can have that effect on people, I mean, that's why we do what we do.
That's beautiful. Can we do a last thumbs up again? I'm just fascinating by this.
Oh yeah, yeah, absolutely. Okay, so yeah, let me plug it back in, and then you can give it a thumbs up again. So yeah,
I love it.
go for it.
So now by just putting my hands on the screen, he controls on a distance, and I'm able to control it and do a thumbs up.
Yeah.
Amazing. So I have another question for you, which is kind of related to what you were saying before. And it's related to the perception, right? Like what people expect and how comfortable we are as a society evolving in that field. And so my question is, in the future, and you can answer for yourself, but also if you think other people might think the same, do you think people will go out of their way to replace all their limbs or some of their limbs if they could acquire superhuman capabilities or even just for cosmetics? Even outside of a disability condition necessity. And is there some things that artificial limbs will never be able to replace that would prevent people from going out of their way to do that?
Yeah, and so that's a tricky question. And if you were to ask me if it's going to happen within the next 50 years, I would probably lean towards saying no.
Interesting.
And part of that will come down to as one of the things I was talking with Eric earlier is that you know the more like subhuman capabilities of these devices, right? We don't have millions of touch sensors that are in the palm, and then we don't have a way of necessarily displaying millions of touch sensors back to the user as well, right? So I mean, with touch being such an important part of people's lives, especially like, you know, the emotional response of touch, that's going to be something that I think is going to be very hard to give up. And perhaps if it gets to a close enough level, we don't know what exactly close enough means yet.
Mhm.
Then it might we might see something like that. But I can tell you this, what I have been seeing more of is for example, people with brachial plexus injuries. So, for example, they have a paralyzed limb that is somewhat painful, right? But they
Yeah.
don't have any like motion in it at all. I have been seeing more elective amputations on that side happening because they can actually gain more function than having like a dead arm, basically
Exactly.
on their body, right? And in those situations, yes, we are actually. I think that
Right.
we will be seeing more of those. But taking a perfectly sound natural hand, that is going to probably be a
A
little
bit
bit
harder.
further off into the future, and I don't know if
And
it's ever going to happen, but
so I like
we'll
this
see.
answer because here's my take on it is that a lot of people are a little bit apprehensive to do, you know, even BCI because it feels like, oh my God, I'm opening my brain and I'm doing something. When traditionally, when you look into cultures, even before the most current events, we always had like piercings, tattoos, and it's always been
Sure.
something no one is afraid of. Somehow, when it goes to the brain or nerves, we think it's another layers than just the skin, which could be like kind of rubberish in our brain. And at the same time, superhuman capabilities versus very precise human capabilities, some people might be okay to lose, let's say, their common sensation on one of their limb if they acquire something so much powerful, like being able to jump higher, run faster, or avoid pain. And I'm wondering if in specific job title or roles, like if you're someone working on the field and you really need the strength, the super strength, or to be able to put your hand through acids or fire to do more, yes, you might lose the capabilities of that hand forever, but then you're acquiring so much more. That hands can connect to Wi-Fi and give you the channel news and so much more. So I'm thinking in those contexts, maybe we might see some people in society accepting that. And we've seen it in the past few years, people like literally adding more sensors to their
Sure.
body. So yeah, that was kind of the way I wanted to think about
Can
it.
I give you my take here?
Please, I would love to hear that. Yeah.
I mean, I do think it's related to how much value the user, actually the person will have. And I give you an example. Aesthetic implants are, everybody is using that because there is a clear impact on your well-being, on your personality perception, and on the impact that you have on the other people. You feel you look younger, you look better, or more near to your ideal image, right? And they are extremely invasive, right?
Yeah.
They're actually terrible. They have they in the past they had terrible, let's say, side effects. The first implants, I mean, the first silicone implants were destroying the bodies of the people. And then there is other situations like right now, you can already have a superhuman sight if you want, like 20/10. If you do implant the lenses or you work on your crystals. However, nobody's doing that. And I think it boils down to the value or the perceived value that you have on yourself by doing so. So I think till it's just a utilitaristic value, I don't think it will ever take off like the sight, because I would love to have 20/10 sight. Would I go over a surgery to do that?
Yeah.
Maybe not. I mean, that's why I don't care.
And it's a very personal answer.
Yes. And I do think is that if there is some something that correlates it about yourself and the value that you can bring away from that without renouncing about anything, of course, that might be takeoff, but if it's just utilitaristic, I don't think it won't be something.
That's a
I mean,
great
maybe would be
take,
niche,
yeah.
you know.
That's a great take. I
So,
think
so
I agree.
interestingly, I was gonna say interestingly on that point. So I actually got LASIK done recently,
Nice.
and
Ashley
and
too. Yeah.
oh, nice. And my vision is actually 2010, and that wasn't necessarily because I wanted an enhancement. It just turned out that it ended up being 2010 vision, and I was just like, oh wow, this is great. Like, and
Life in 4K.
exactly. So that was
No, it's
a
terrible.
nice
If you
side
watch
effect of
yourself
it.
in a mirror, then you see that you're getting old. It is terrible, this
Silly, absolutely
But
silly. Yeah. Before we truck on, I want to just get a little bit of insight from you on like the future of Psyonic. You know, you're kind of in the space. Are you looking to expand to other products in the future? Like this could be way far ahead. Like, what's your vision? What's your vision for this?
yeah. So we're definitely working on other limbs as well. We've got like a 5-year goal of making an ability leg in addition to our ability hand that you could do a triathlon in. So we moved to San Diego in the last year, and we're working with we want to work with the Challenge Athletes Foundation, which is headquartered there, and the military hospital and UCSD to do things like the triathlon, run, bike, and swim with a leg. So that's in the works. We've got like wrists and elbows in the works too, and so and then directly interfacing that with the body through nerves and bones. So that's all in the future for Psyonic. So it's going to be really exciting.
I am excited.
So cool. So cool. So for anyone who's listening, watching, where can they find like more about you? And I know you also have a crowdfunding campaign where you're like accepting kind of like funds from like the general public, right? Or from folks who are interested in supporting you. Can you tell everyone like a little bit about that and how they can find you?
Yeah. So anyone can go to our website. It's Psyonic Psyonic.io. And if you add /invest, then you can actually go to our crowdfunding campaign at the end of that, or just go to our main website and there's links to it there too. And as you mentioned, yes, we're in the middle of an equity crowdfunding campaign, and that's open to the public, so anyone can invest in the company and for as little as $250 and be part of our bionic revolution. And I'll say on that note too, one of the most beautiful things about that is that our own patients have been able to invest in the company, and that's typically not something that happens with, especially medical device companies, that the end users can actually be part of that. So it's like they get to be a part of us making this for them, and that's like one of the most beautiful things that we've found.
Oh, awesome. Menu. Thank you. Menu screen sharing so we can see the website go through. Yeah, it's such an amazing looking technology. It's brilliant just in terms of its use and its empowerment for people. So thanks so much for sharing that, letting people know where they can find it, learn more. But that's it. That's unfortunately it. We've hit the hour mark. Thank you so much, Dr. Aadeel. Like, you're the amazing founder of this company. You're so inspiring. Every time like we see you, you're just doing amazing things, and you have such great energy. And so just thank you for being yourself, just sharing your stories, allowing us kind of like a peek into in the future of what you're working on, which is super cool too. So thanks for joining us and this amazing conversation around haptics, bionics. For anyone listening, you've got to check out thehapticsclub.com. Follow us on LinkedIn. We're on all the socials. Our blog is live now. We've got a shop, and you can basically read from all your favorite hapticians. They're sharing on our blog, which is awesome. Tutorials, editorials, all those fun things. And of course, we wouldn't be here without the support of people listening. So if you're on Spotify, you're on like Apple Podcast, Google, wherever you're listening from, you're on YouTube, we just want to thank you for being a fan, because we're fans of so much of you. A lot of the coolest people in haptics are listeners. So we will see you at the next episode. Till then, stay funky, stay fresh, and just stay curious.
Yes.